So then, all right, so patient comes back. Patient comes back. What you can also do too is when you're removing it, you can also numb the eyes when you remove it as well.
Sure.
So they make it a little more comfortable.
Sure. The blinking.
And then same thing. You ask them how they're doing. You can feel it on there.
It's good slippery. Yeah, because it wraps around the outside of the ring.
Exactly.
Right? I was gonna say, as I hold it, I can tell there's something slick.
You
It's
can-
not
you can-
flat. And then just grab the edge. Yeah, that does make sense. Under it. To break it, so Dr. Sarin can still use it. Beautiful. Okay. The blue ring side. Okay, I see it there.
I'll edit it so.
Slippery. The membrane itself is fairly slick once it's in position.
Yeah.
It wants to slide.
There are these like purplish gloves that I've seen doctors use that I think have a little bit better grip.
Yeah, this I can tell is very slippery.
Exactly. So I can have them
Prerequisite at this point.
have them look down, pull the top of it up.
Beautiful.
Yeah, super.
It's not bad.
Super easy, right?
It's probably the worst things on the patient.
I love that reference.
When it's probably feeling the best is about when they're taking it out.
There's almost nothing, right?
Yeah.
There reminds me a lot of like just generally just a contact lens, except the discomfort's higher. But like you said, a few days worth of foreign body sensation.
Exactly.
slowly
And that's why we want them to essentially